So there's several ways to treat venous disease. In the old days, the old treatment was surgery, where we make an incision in the groin and we cut the vein that's bad and we have to strip it out. This was the old treatment done about 30 years ago. Well, over the last 15 to 20 years, that's no more. Today, we treat venous disease with either a laser, a radio frequency machine, and it's essentially a walk-in, walk-out procedure, because the stripping and ligation was solved with all kinds of problems. It was done under general anesthesia in the hospital. It required pain meds post-surgery. It was fraught with severe bruising, tenderness along the treated vein, and recovery was up to 4 weeks. High failure rate as well, and recurrence rate. So that was the old. Now there are new treatments over the last 15 to 20 years. It was done with a venous ablation. Essentially what we do is we start an IV in the vein, and through the IV, like in this cartoon here, we use a laser catheter or radio frequency catheter or now glue, and we put the laser into the vein and essentially close the vein under ultrasound guidance. This is just a simple IV into the vein, surround the vein with anesthesia, and shut the vein closed using the laser or heat energy or even just glue. So it's very simple. It's walk in, walk out. We still seal the vein. Procedure is done in 15 minutes. This is an example of the radio frequency technology I spoke about. There's up to 15 years in experience. Over the last 3 years, there's now a glue-based system where we glue the vein together, glue the vein shut. That's only some insurance companies cover that. So what are the advantages of this minimally invasive therapy? Well, many of them. It takes less than 15 minutes in my hands. The slide says an hour, but it's less than 15 minutes. It's done in the office, in the comfort of the office, which is just walk in, walk out of the office. It's up to 98% success rate. There's immediate relief of your symptoms, and you return to normal activity pretty much at the same time. I've had ladies just go straight to the mall after doing a procedure in my office. There's no general anesthesia. There's no hospitalization at all. As minimal, or actually no scarring is involved with the procedure. And it's typically, this is key, it's actually covered by medical insurance, even Medicaid. Medicare, Medicaid, insurance covers it. Just have to sort out your deductible. We'll help you with that through that process, but it's covered as a medical condition. It's covered. A lot of people don't know this, but this is actually covered by insurance.